For those of you who don't know me, I'm Juliana Serrano. I'm the Senior Associate for Peace and Justice in the Office for Creative Connections here at All Saints Church. And I am so glad that you're here for this special forum presentation. I want to welcome you, especially if you are new to All Saints and you are visiting with us this morning. If you would like to be kept apprised of future events of interest here at All Saints Church, there are green contact sheets over here at this L-shaped table. Judith is waving her hand and also waving the clipboard. Please go ahead and make your way to that table and fill it out with your email address so that we can utilize your contact information to keep you current with all of our happenings. Also, there's a welcome table that is just outside of Riga's house, and you can pick up a red welcome bag there, which includes a welcome card for you to fill out and learn some more information about some of the wonderful offerings and ministries that are a regular thing here at All Saints Church. If you weren't in our 9 o'clock service, you haven't heard about our very important action today, and I would like to share that with you. As you know, each week we put our faith into action, and this week we especially do so as we urge House Speaker Paul Ryan to allow the House to vote on 3 important pieces of legislation. One that would prevent individuals on the terrorist watch list from purchasing and owning firearms. The second would be to require background checks be conducted on all private sales of firearms. And the third would be to renew and strengthen the federal assault weapons ban. So these are really important pieces of gun legislation that need to get passed at the federal level. We're really lucky to live in a state that has very progressive gun control laws, but we need to make sure that this kind of reform is implemented nationwide. So please stop by the action table. Again, that L-shaped table right by the doors. We also have the opportunity to send notes to the community of Orlando and to those in particular who found Pulse to be a community center for them. And we want to let them know that we share their pain, we are in solidarity with them, and most importantly, that we love them and that we grieve with them. So if you would like to send a note, we have those also available at the action table. They're also available at the action table out on the lawn if you need to take some time writing that note. Our plan is to send those over to Pulse and express to them again our deep grief over their loss and to let them know that we love them and stand with them. So please join us in that part of our action. I want to share with you a little about how today came to be because it is an unfortunate coincidence with the timing. It was with the support of the All Saints Gun Violence Prevention Task Force that today we honor and we celebrate Ask Day. The Ask campaign promotes a simple idea with the potential to help keep kids safe. It encourages parents to ask if there's an unlocked gun in the homes where their children play. Unfortunately, in America, 1 out of 3 homes has children has a gun in it, and nearly 1.7 million children live in a home with a loaded, unlocked gun. Every year, thousands of kids are killed and injured as the result, and this is something we actually can make a difference on. I mentioned the Gun Violence Prevention Task Force, and I just want to give them a brief plug because it's their connection to this forum today. The mission of the task force is to educate, advocate, and organize to prevent gun violence and to respond to the impact of gun violence through sustained action in partnership with advocacy groups, elected officials, school, children, youth, families, public safety officials, public health officials, and interfaith leaders. I think we have a few members of the task force here with us today. If you could stand or wave your hand just so that you could be identified, I'm sure there will be more people today that would like to get interested in the work of the task force. Again, it was the task force that suggested we pair this Ask Day with a presentation in the forum on gun violence. And in response, we invited 2 experts in our midst, Dr. Huey Merchant and Dr. Jack Scott. Huey will start off today's forum educating us on who and how persons can commit acts of gun violence And Jack will later share with us his family story and how policy can and should make a difference in reducing gun violence in our nation. Let me formally introduce you to them, beginning with Jack. Jack is an educator and former Democratic politician and currently a scholar in residence at Claremont University. Earlier in his career, Jack served as president at 2 California community colleges, including Pasadena Community College. He was a member of the California State Assembly and the California State Senate, and served as chancellor of the California Community Colleges system. Jack is very active in gun control. He began his career in gun control efforts after his son, Adam, an attorney who had recently graduated from USC Law School, was fatally shot at a party with one of his friends. One of his friends had a shotgun in the home, which he did not know was loaded, and his friend discharged the shotgun, hitting Adam and killing him. Huey is a board-certified child, adolescent, and adult psychiatrist. He currently serves as a psychiatrist at the Child and Family Guidance Center in Palmdale and at Penny Lane Centers in North Hills. Huey specializes in treating the underserved community, working in clinics, schools, and residential treatment facilities. He's committed to the well-being of children and families and works to help them overcome adversity and realize their own strength and potential. He and his husband, Steve, are members here since 2008 and were actually one of the first same-sex couples to be married at All Saints. So please, let us welcome Dr. Huey Merchant.
Good morning. So I'm Huey Merchant. I've been at All Saints now for a little bit over a decade, and as mentioned, Steve, my husband, and we were one of the first ones married here, June, right before Prop 8 years ago. And I'm a child and adolescent psychiatrist. I work here in Los Angeles County, work in San Fernando Valley, also in an Antelope Valley, and I work for the underserved, mostly socioeconomically disadvantaged. I work with mainly Black and Latino populations. I see a lot of trauma, abuse, neglect, aggression, depression, ADHD, suicidal ideation, autism, intellectual disability. And actually, it was at the end of May where I was asked to talk on gun violence here. And initially, when I was asked, I don't really see myself as a gun violence expert, and I was kind of hesitant to say if I was going to speak or not. But after talking with Zelda and Juliana, it's really hard to speak about gun violence if we don't talk about mental health. So I agreed, and literally the day after I agreed and onwards, it's just been like gun violence, gun violence, gun violence, gun violence. 24 hours after I said yes, UCLA shooting happened. A few weeks after that, from The Voice, Christina Grimmie, she was killed. Last Sunday, Orlando, the largest mass shooting in US history. So just kind of take a moment for a bit. I know in mental health, we talk about how are you feeling, how are you feeling, how are you feeling. But for a moment, if you think about how you were feeling last Sunday when you heard about the Orlando shooting, how did you feel? Like, how'd your body feel? How did your mind, how did your heart? I know for me, at the moment, it was all in my head this whole 3 weeks anyway. I was Sandy Hook, Arizona, Fort Hood, like all this stuff is spinning around. And for me, even very personally, I felt like Charleston hit me kind of hard. You know, when the 9 African-American people at church were killed, when a young Caucasian person came in and killed them after Bible study. And, you know, it kind of hurts, but Orlando, it was Pride Day. When I heard about it, it just kind of physically hurt. I was sad, I was anxious, I was ruminating, kind of thinking about all these things, and I just took a pause of like, what's going on? Like, that could have been me, and like all these thoughts kind of running in my head. You know, I reached out to my husband, talk about to my family, friends, support each other, try to understand all this craziness. And Sunday passed. I'm ready to go to work. I go to work on Monday, and I'm ready to see one of my patients. I'm anxious to see her. She's 15 years old, and she was deliberately scheduled to see me on Monday. We made this appointment on purpose because we wanted to be after Pride weekend. 15-year-old Latina girl, very conservative family. She had had a long journey. She is very proud of her journey to get to the point that she was coming out to herself. She came out to her family, and her family made an amazing journey as well. They were supportive of her, and she was so excited and so proud that she was going to go to LA Pride with her mother that weekend. So I knew Monday was here. I was wondering how is it going to be when I see her in the morning. She comes in, and the first thing she talks about is Orlando. She's depressed. She's anxious. She's talking about her anger, her fear, her confusion, her anxiety. And she says, quote, "If I were to go to Pride or anything that involves the community, bombs. I just feel like they are trying to kill everyone in the community. I didn't think it would go this far." And she just kind of paused, and she's like just sitting there staring at me. And I was like, she said her mother would not allow her to go. She said at this point her mother would not allow her to go to any LGBT outing or group out of fear and anxiety. So now we're dealing with a whole new set of symptoms. And that's Orlando. That's Orlando's shooting. That's the impact that it's having on one of my patients. The impact, it's traumatic. It's the impact that it's having on all of us. So, coming here, one of the questions that often arises after these shootings is, who are these people? Who are these people? Who are these people using guns to take human life? So I thought I'd talk about three groups of people. I want to talk about lone wolf, mental illness, and these accidents. So I want to start out with lone wolf because it's kind of the elephant in the room, particularly after Orlando. It's come up again, and that topic has come up, and people don't really seem to understand, what is that and what does that mean? I got a lot of the information from my brother-in-law, Victor. He has a master's in terrorism and counterterrorism. He's a retired police officer, terrorism liaison officer, hostage negotiator, retired major of the Army National Guard. He has experience in Iraq, Asia, Central America, Europe. So he's a great resource. Questions afterwards, he'd be happy to answer them. But lone wolf is an individual who commits terrorist attacks alone without written support from others. The perpetrators may be in contact with others, but those other individuals are not aware of the perpetrator's plans or intentions. Many lone wolves actually represent a really small percentage of the actual incidents of gun violence in this country, but they've been on the rise since 1990. They're on the political right and they're on the political left. We talk about white supremacists, we talk about anti-abortion activists, we talk about anti-government, Islamic fundamentalists, but they're also the environmental activists. They're also the anti-animal rights activists. The immediate victim of the attacks is not as important as the broader message. The most common means are firearms and explosives. They don't belong to an organized terrorist group. They act without direct influence of a leader, they have very violent views, and they explore extremist media. Many times, they feel as if a war is being waged on their own ethnic, political group, race, or religion. And you know, it's been in this most recent primary a lot. But I think there is something said, and I do agree with the suggestion that the recent comments of a perceived war on someone's religion may incite a lone wolf terrorist. The anger that comes out, it brings out the desire to right the wrong. They're fighting for a cause. They're acting on the behalf of other people. And they want to send a message to policymakers, adversaries, and their supporters. They almost can feel like they're a hero. And they have this feeling like they might inspire other people. So many have black and white worldviews. Many have mental illness. Many have poor social skills. and many are or were loners growing up. Many attend extremist schools, speeches, and rallies. And but lone wolf is nothing new. It's been around for centuries. It's been around for a very, very long time. But the rise since the 90s is partly due to the internet. Easy forum, source of friends, sense of belonging. You can be anonymous. You can derive inspiration from larger terrorist groups, ideology from the internet. You can also feel at home and safe in your environment while you're exploring your fantasies. You can share plans and actually, you can encourage and be encouraged to carry out certain acts. And you can more easily elevate your status to be this hero on the internet. Your actions, successful ones, can be copied by sympathizers, and you can inspire others to join the movement. So when you think about Orlando, and you think about the largest mass shooting in US history, 49 or 50 if you're including the shooter, and how it's horrific. But how horrific that is, that's 50 people. It's horrifying to hear the statistics of gun violence in this country. 32,000 people every year die from gun violence in this country. That's 297 people that are shot every single day here in the United States. And of those, 55 kill themselves. 31 are murdered. 2 are killed unintentionally, 1 killed by police intervention, and 1, the intent is unknown. On average, 7 children and teens are killed by gun violence every single day. And it doesn't make a difference if you're in urban cities, it doesn't make a difference if you're rural. In rural, it's more suicide and unintentional acts. In the urban areas, it's more homicide. But firearm homicide by firearms is the second leading cause of death in youth under 20 years old. That's here in this country. And they will tell you that when they mention the statistics, they talk about 76,000, approximately, 76,000 people survive gun injuries in the United States every year. But for me, that's like a drop in the bucket. That's a really small portion. I told you about my patient. She's affected. She's not directly affected, but she's definitely affected. Many mental illness is largely overlooked. But if you look at the people that are really truly affected by gun violence every year, it's massive. The people witnessing it, the people hearing about it, the real impact of losing a loved one, your child, your mother, your father, your caregiver, the breadwinner of your family. If that person is dead, what is the real impact to this family? What's the real impact to that person? More than 1 out of 5 US teenagers, 14 to 17, say that they've witnessed a shooting. That's over 20% of teenagers. Can you imagine what the impact of that is? So, I want to talk about the people with mental illness. Some of these people who are using guns to take away human life. It's common for shooters to have mental illness. Again, 55 people are killed every day by gun violence. They kill themselves, 55 people. Anxiety and depression symptoms come in many different ways: isolation, withdrawal, also suicidal ideation. I have a teenager whose father was killed, and he's isolated, he's depressed, he's suicidal. But then I have another kid who was referred to me from school because school truancy, all these suspensions, he's fighting, he's aggressive. Come to find out, all this started after his brother was killed by gun violence. He doesn't say it, he doesn't talk about it, but these are his symptoms. We talk about conduct disorder, we talk about antisocial personality disorder, we talk about gun violence regarding the gang violence. Greg Boyle has been here multiple times. We know Homeboy, we love Homeboy, but we all know gang members and others are not running towards a gang. They're running away from the traumatic home life, violence, abuse that they've been exposed to. As Greg Boyle says, kids joining gangs are always fleeing something, always. There's bipolar, there's substance use, there's schizophrenia. They say Ted Kaczynski, the Unabomber, was schizophrenic. The one, Gabby Giffords, the Arizona shooting, the one that killed all those people there too, diagnosed schizophrenia. And I'll even bring up ADHD. People say, like, why are you gonna bring up that? But I don't know what the shooter had. I honestly don't, but I'm looking at certain articles, they talk about his family stuff, his aggression, but some of the stuff that sticks out to me when I'm reading it, some of the quotes, third grade teacher, quote, very active, constantly moving, verbally abusive, aggressive, end quote. Quote, hands all over the place, in his mouth, end quote. Middle school teacher, quote, focusing on classwork, has difficulty focusing on his classwork since he often seeks the attention of his classmates through some sort of noise, disruption, or distraction, end quote. Quote, attitude and inability to show self-control in the classroom creates distraction and becomes a main source of difficulty for him. Multiple suspensions, I think expulsion, didn't graduate from traditional school, and ends up finishing, I think, a community high school, adult community high school. Many times for me, I see ADHD a lot. Many times we talk about, the risk and benefits of therapy and medication. But I also make a point to talk about the risk and benefits of doing nothing. Many of these kids have problems focusing. They're good kids, but they get singled out as bad, disruptive kids that aren't listening, aren't doing what you're supposed to do. They struggle academically, they struggle socially. They end up doing very poorly in school. Some of them end up dropping out, going to drugs. Not all of them, but some of them. And these are some of the people that are kind of left out of the community. And it does impact. So there are many ones with mental illness that are behind some of the guns. Many use guns that take human life with mental illness, primarily their own. Lastly, I want to talk about those behind guns with the accidents. Who are they? That's basically anyone who has access to a weapon. Anyone. 9 children and teens are shot each day in gun accidents. That really should be enough said. But listen to this. 2007, preschool age kids, 85 killed with gun violence. In that year, it was actually more than police officers were killed in the line of duty through guns. So many times they ask, what can we do? What can we do? So control. We got to control the access. We really need to. And as Juliana said, part of the reason why the forum happened today is it's National Ask Day coming up, ASK. Ask campaign, we wanted to bring attention to that. Ask stands for Asking Saves Kids. It's something that everyone can do now, and it's something that everyone can pledge to do on Tuesday. June 21st is the first day of summer. That is why that date is chosen, and it's because it's the season where most kids are spending more time outside of their home and other people's homes. So they want to remind parents, ask, is there an unlocked gun in the home where the children are playing? And as she mentioned, 1 out of 3 homes, there is a gun. 1.7 million, there's a loaded, unlocked gun in the home. 80% of unintentional deaths with kids under 15 occur in a home. So it's normal for parents to ask, any allergies, any food allergies? Any dogs? So my kids have dog allergies. Do you have that internet access? That's about video games, but they want to ask if there's a gun. So when you ask how to bring up this topic, just bring it up with everything else. Just bring it up like it's the norm. Or use this date on Tuesday and bring it up. Pledge to bring it up. Talk to your friends, talk to your families. Make an effort to bring it up that day and afterwards. What else can we do? Policy. Jack Scott's going to talk a little bit more about policy. But we've got to support congressional action, background checks, different types of weapons, but support the leaders to kind of affect some change. What else can we do? Work to change the hearts and minds to see gun violence as a public health issue. Recently, the AMA said gun violence is a public health crisis. The AMA is the American Medical Association. It said, quote, with approximately 30,000 men, women, and children dying each year at the barrel of a gun in elementary schools, movie theaters, workplaces, houses of worship, and on live television, the United States faces a public health crisis of gun violence. And that's just the deaths. Trauma victims have higher rates of mental illness and substance use. Those exposed to violence have more physical complaints. And the rates of non-compliance in trauma victims to other chronic medical problems like diabetes and hypertension is much higher. If you actually look at it, the lifetime effect, the lifetime impact of gun violence is in the billions. So the AMA asked for the CDC to be able to conduct research on gun violence, but it's been blocked. Back in 1996, funding was blocked on the urging of gun lobbyists that claimed that the agency was biased towards gun control. So it's now been asked, we need to do research. We need to do research to have more information about how we combat this crisis. And we need to push our political leaders to do so. Almost done. What else can we do? We need to take care of ourselves. And it sounds, like, what does that mean? Physically, emotionally, mentally, spiritually, we need to take care of ourselves. Exercise, sleep, eat well, meditate, mindfulness, whatever it is, we got to take care of ourselves. No one is immune to mental illness, no one. And we can't take care of other people. It sounds cliche, we can't take care of other people if we don't take care of ourselves. And we get triggered by other people if we don't take care of ourselves. People may need help, but we just don't want to be around them. We need to take care of ourselves. What else can we do? We need to focus on community. See something, say something, do something. We gotta refer people, we gotta reach out to people, we gotta connect with people, refer people to get help. Support policies that not only limit access to gun violence, but support policies that fight mental illness, support policies that fight these triggers, policies that impact access to mental health, policies that impact access to substance use, policies that impact the stigma of mental illness and the stigma of substance use treatment, policies that affect equality, racial, gender, sexual identity, income equality, all of that. Policies that affect homelessness, policies that affect poverty. We got to do more to affect these things that are really impacting these people. The bad news is that recent brain studies show that trauma negatively impacts brain structure and function. But the good news is that relationships, positive relationships, heal. Positive relationships, they heal. Communicate with each other, have conversations, reach out, help, reach out, support, reach out for the sake of reaching out. We see isolation daily, we see it individually, and we also see it ideologically in this little bubble that we live in. We're like, we're on the left, we're on the right, we're not gonna reach out. We don't do more, even on this issue of gun violence. I remember doing Prop 8, working with Courage Campaign. They asked us to go out and canvass. They asked us to go out and talk to people, share our stories, and actually communicate with these people, commune with these people, communicate, because it can change hearts and minds as well. Difficult in a place like LA. It's built to be in bubbles. It's built to be isolated. We have to deliberately do something different. Foster care, homeboy industries, big brother, big sister, we can all deliberately make differences in this world regarding gun violence in different ways as well. Look at the people at Homeboys. It's a good example. Community, love, and support can be transformative. Mother Teresa calls it, we belong together. Greg Boyle calls it kinship. As human beings, we do better when we feel we're a part of a community. Many of the shooters were lacking community. They were lacking support. Thanks.
Thank you, Dr. Merchant, for those very insightful remarks. I don't have a lot of time, so I'll try to speed this up. When I did review that horrible incident in Orlando, I had all kinds of emotions, and certainly one of those was the emotion that Lacreta and I experienced when we too were found a knock on our door that informed us that our son was shot and killed. And it takes a long time. You actually never get over something like that. But one of the things that we tried to do was to turn that grief into something positive. And so often we were called upon to console parents who had lost a child, whether by gun violence or by some other means. I worked with George Regas, who had been very sympathetic with me at the time of that loss in terms of the founding of a coalition for a nonviolent city here in Pasadena. And then I was fortunate in 1996 to be elected to the state assembly. And 4 years later, I was elected to the state senate and served there for 8 years. And during that time, I became a very vocal proponent for gun safety bills. I was able to author 13 bills that were into law. I won't go into all of those, but I will mention to you that I had a bill that simply said that every gun in California would have a safety lock with it. And as was pointed out by Dr. Merchant, very frequently what happens in a home when a gun is unlocked is that some child finds it, begins to play with it, and either kills himself or herself, or perhaps kills another child. Then I also passed a law which said that in effect that anyone carrying a concealed weapon without a permit, and fortunately the state of California is one of the 8 states that require that you have a permit to carry a concealed weapon, that if that person was found, that they could be tried for either a misdemeanor or a felony. Before that, it was only a misdemeanor. So you can imagine that that didn't exactly deter anyone from carrying a concealed weapon. As a result of that bill, some 3,000 people a year were arrested, and over half of them were charged with a felony. And thirdly, I carried a bill that had something to do with mental illness that said, in effect, if someone had a 72-hour hold, that someone was a person that was viewed as dangerous in terms of mental illness, that their right to purchase a gun was taken away for at least a period of time until it was proven that they were healed. I want to join exactly what Dr. Merchant said about the fact that this is a public health problem. Can you imagine if over 30,000 deaths were occurring every year for some other cause, that we wouldn't do something about it? Suppose there was an airplane crash every day that took 88 lives. Would we simply shrug our shoulders and say that we can't do anything about it? I'll tell you what happened in America about automobile fatalities. Over a period of time, we reduced those in 4 or 5 decades by over 100%. What did we do? Well, we simply put seat belts in cars and required them, airbags. We determined to pad the dashboard and make the steering wheel collapsible. We tightened down on drunk drivers, and we made a difference. And we could make a difference if we had the courage in the United States. Do you realize that in the United States that we have 12 times the rate of gun deaths that the other 25 nations, industrialized nations in the world combined? We don't have a higher crime rate of rape or automobile theft or those other things, but gun deaths. Gun deaths make a difference in this country. And it's really an insanity that we allow people to have such a ready access to guns. 66% of Americans agree that everybody who buys a gun ought to have to register it. Yet today, gun shows go on. People buy guns willy-nilly. They can order them over the internet. There's a big loophole in that. And some way or another, the NRA has so intimidated our elected officials that nothing happens. Now, when I decided to run for office, there was one thing that I determined that I would do, that I would make a very vocal, powerful statement about how I believed about gun safety. And on one election, the Gun Owners of America spent $50,000 against me as a result of that. But some way, somehow, we've got to give the courage, and we've got to be individuals that will speak up for these bills that make sense. Registering, cutting down access to assault weapons, we had that at one time. Unfortunately, during the Bush administration, that expired, and we haven't had the courage to pass it since. I know a Congress member from Massachusetts who's a veteran who used these assault weapons in war and say they have no place on our streets. Of course they have no place on our streets. Why would anyone want to have an assault weapon that will fire hundreds of times without reloading? Now, you want them to say, well, there'll be deaths regardless of whether you rule out the assault weapon. Of course, there'll be deaths. You know, Cain killed Abel before there was ever the invention of guns. So I understand that that's something that's going to happen. People can use a baseball bat or a knife to kill somebody, but they won't kill as many people. I'll guarantee you, even if that young man who did that horrible act in Orlando had walked into that club with a handgun, he would have had to reload, and he couldn't have killed 49 people. So it's a public health problem. And I'm glad that Dr. Merchant addressed the issue of mental illness. That's a public health problem. Domestic violence is a public health problem. Fortunately, in California, we have a law that says if someone is convicted of domestic violence, their right to own a gun is taken away. Far too many women throughout America are killed by someone who commits domestic violence, and then his rage leads him to go and purchase a gun. So we must, as citizens, take a stand. After all, isn't Christianity have something to do with nonviolence? Isn't Jesus who said something about blessed are the peacemakers, for they shall be called the children of God? Didn't he say that we ought to love our enemies and we ought to treat our neighbors with love, treating our neighbors as ourselves? And so if someone in the name of Christianity spews hate, I can't imagine, for instance, that a Baptist pastor, I almost said the wrong word, didn't I? I guess I'll reveal my thoughts, but nevertheless, a Baptist pastor in Sacramento praised the action that took place in Orlando because he said it got rid of pedophiles and molesters. That's the kind of hate we have in our country. There was a county in Alabama that refused to lower the flag to half-mast. So we've got to look at the roots of this kind of hatred and violence in America. We've got to be voices of peace and nonviolence, but we've got to have the courage to adopt policies. The state of California has been one of the leaders in terms of gun safety and gun violence. Fortunately, our deaths by guns is below the national average. We have all those things, like poverty and other things, that beget violence in our communities, but we've had enough courage to step forward and to do something different on the gun issue. We've realized that there are things we can do. And I encourage you, and I'll tell you very quickly, I want to know what somebody believes on these issues of guns before I vote. And I will not vote for someone who has the senseless view that some way, somehow, that an access to guns is going to cure gun violence. That one of our presidential candidates said that, well, if somebody in Orlando had just had a gun strapped to his side that he could have stopped this shooter. Did you know that if you have a gun in your home, that you 3 times the rate of homicide is more likely to occur in that home, and 5 times the rate of suicide? So these are the issues that are confronting America today. I'm glad to be able to discuss them with you on this unfortunate, just a week after such a tragedy occurred. As someone pointed out earlier in introducing this program, it was a coincidence that we were talking about gun violence. But let's hope that this tragic, tragic incident, here we are, we all love America, and yet we are ashamed of the fact that we have 12 times the rate of gun deaths in America of 25 other industrialized nations. Thank you.
So regretfully, our time is up, so let us give our thanks again to Huey and Jack for this important conversation. See you in church.